Hello, my name is Mohammed Abahajli, the founder and CEO of NEMS Diaper. Infant dehydration is amongst the most prominent ailments affecting babies all around the world, and it often runs unbeknownst to parents until it has progressed onto later symptoms and consequences. Babies can't express their specific needs, so thirst might not be something that parents tend to right away, rather opting to feed the child instead. With infant body composition consisting of more than 80% water, it is of paramount importance to ensure your child is well hydrated. That's why we invented the dehydration detection diaper, an innovative diaper used to detect infant dehydration early on. The purpose of the dehydration detection diaper is to aid parents with infants ranging in age from 1 to 12 months old in detecting early stage dehydration by measuring urine acidity levels. This is done through the use of a thin layer of bromophenol blue paper placed at the bottom of the diaper. Unnoticeable to the baby, it sits furthest from the skin relative to the rest of the layers and functions with no added needs from the parents compared to conventional diapers. When interacting with urine, the bromophenol blue paper will change in color, ranging in severity of color change from green to yellow, indicating to parents the acidity content of their child's urine. With less water in the body, the concentration of solutes in urine would increase, leading to higher acidity. So therefore, the higher the acidity, the more dehydrated the infant is. With such a quick and simple test, parents can be informed of their baby's needs and accommodate as such. We're so excited to share our new innovative design with you. So here's Dr. Sabbah to tell you more about the science behind it.
Now, from a scientist's perspective, let's look at science behind the product. Our product takes the approach of starting with a regular diaper design with a little twist. The plan here is to test the acidity of the urine in infants who cannot directly communicate the major signs of dehydration. This is very important, especially that prolonged dehydration can cause kidney failures. The kidneys are the waste collectors of the human body, and their main function includes filtering waste out of the bloodstream. Blood contains lots of minerals and water molecules that pass the first filter of the nephrons. A collected mixture of minerals, water, and waste continue their journey until they approach the ascending and descending loop of Henle. The loop of Henle is outlined with a network of capillaries named the vasa recta, and the membrane of the loop of Henle is permeable to water and sodium chloride. For a person who is severely dehydrated, the water concentration in the vasa recta is very low compared to the solution in the loop of Henle. Osmosis takes place to reabsorb the water back from the urine into the bloodstream before going to the collecting duct and eventually excreted as urine. The absence of water concentration in the urine increases the concentration of sodium ions and the tubular secretion of hydrogen and ammonium ions. The combination of the high concentration of those ions make the urine more acidic. The usual range of pH for the normal urine is from 4.5 to 8 on the pH scale. However, during dehydration, the pH of urine drops further, making it lower than 4.5 on the pH scale. In this specific case, using bromophenol blue is more convenient than using blue litmus paper indicator. The bromophenol blue indicator is active at pH range of 3 to 4.6 on the scale, meaning that it's only active when dehydration occurs in infants, to the contrary of the blue litmus paper.
Hello, my name is Dr. Masha. I'm a pediatrician at the Waterloo Hospital. The dehydration detection diaper is a product I will highly recommend to all my patients, especially to the parents who are very concerned with their children's hydration level because of an underlying disease, or merely just to check for hydration from time to time using a very non-invasive method. Dehydration can be very detrimental to an individual's health, considering our body is made up of 60% of water in adults, around 75% in infants, and 65 to 70% in children. Water is necessary within a plethora of functions in the body, like regulation of body temperature during heating up leading to perspiration, the metabolization of food, as well as joint lubrication, and more. Infants are made up of a high percentage of water. Therefore, they also have a higher risk of becoming dehydrated. This diaper would highly benefit parents of infants between 1 month to 12 months. This is due to the fact that infants are at a higher risk for dehydration because of their quick metabolic rate, their developing digestive system, and their inability of their kidney to conserve water effectively. Infants have a high metabolism because they're growing quickly and have higher energy demand while also needing more energy to keep their body temperature consistent. As the body undergoes chemical conversion, water is lost throughout the metabolic process, and this leads infants to lose water very quickly. That's why we need to feed them at a very constant pace throughout the day. Their immature gastrointestinal system makes it very hard for babies to keep their food down, equating to babies spitting up or randomly vomiting. This naturally happens very abundantly in infants because their GI tract is still developing and the child's esophageal sphincter does not fully close. This allows the milk to be refluxed back up to the esophagus and out of the mouth, causing the infants to lose water. As for water conservation, when the kidneys are excreting waste at a very, very rapid rate, the infant's body is metabolizing everything. The child loses water during the waste excretion, especially when faced with diarrhea. The simple fact that an infant's kidney not being fully developed leads to less efficacy in conserving water. Overall, the dehydration detection diaper is a great tool for parents to have on hand to check for their children's hydration level from the ease of their home using a very non-invasive method. Now, I'll pass you guys back onto our development team to talk about the product a little further.
Now let's look at the product regulations. A medical product or device can be anything ranging from a basic tongue depressor to a complex programmable software. These medical devices can consist of products like test kits and reagents, which is the case with bromophenol blue reagent. The dehydration detection diaper is constructed for medical purposes and is considered a medical device. This can be first analyzed through its makeup. A dehydration indicator like bromophenol blue reagent can indicate the levels of dehydration in response to urine placed inside the diaper. The indicator represents a qualitative indication of dehydration via the acidity strength through a change in color. For example, adding bromophenol blue reagent will turn the color red if the solution is acidic. Also, the hydration detection diaper will come with a pH comparison scale for the parents to analyze and determine where the urine strength of the child is located at. As a result, a clear indicator of whether the infant is hydrated or dehydrated will become apparent and further action can be taken. In addition, understanding the classification of medical product is very important. The Federal Drug Administration classifies the devices with respect to the risks posed by the device. The hydration detection diaper lies under Class 1, since Class 1 describes the devices with lesser risks posed to consumers than other devices. These low-risk devices, like masks for example, are dependent on general controls. General controls corroborate both safety and efficiency of the device. Thus, a breakthrough therapy pathway for the FDA would be proposed. This is because the availability of the hydration detection diaper would be in the best interest of the infants and young children that may be dehydrated or suffer from a diuretic disease. That being said, proposing a breakthrough therapy for the Federal Drug Administration to approve the dehydration detection diaper is a low-risk class medical product that is comprised of a bromophenol blue reagent that will efficiently aid in determining medical complications such as dehydration in infants and young children.
Within a product's design, there are various rules and regulations one must follow down the patent retrieval path. The five criteria specificity, usefulness, non obviousness, novelty, and replicability tests are the key factors used to determine the patentability of a product. For a patent to be applicable to a product or device, it must suffice all these criteria to gain approval. But this wasn't the case for our product. The specificity of our product was unique based on its design, which housed the bromophenol soaked layer in the front of the pad to determine higher ionic composition changes in urine. The product isn't readily available in the market today, making it a useful addition to the conventional diaper, while still providing basic diaper functions. The diaper's adaptation to add the indicator layer in the pad of the diaper isn't a current implementation in companies today, and is an innovative approach to health regulation in diapers. By applying a non-obvious test to our product, we can determine that it would adhere to patent guidelines, since the main function of diapers is only on hygienic purposes and not on the health and functioning of internal processes. A person skilled in the art, or more formally known as BICIDA, would determine that the product varies from regular diapers with the addition of a new function for a new purpose. Our product would inevitably fail the novelty test, as it would become a predictable product when related to patents in the market today that share the same premise as our product. A patent that applies to our similar design has received patent approval for their product, therefore making our diaper a predictable product based on the similarity of function. Overall, the dehydration detection diaper would fail patent eligibility since it is a predictable product in the market today. The diaper sadly won't suffice the novelty test, making it an obvious invention that would be anticipated based on prior art from various other patents. Although our product meets the requirements for most tests, the lack of one factor will halt the advancement of our product and can inhibit further advancement in acquiring a patent for new concepts. Acquiring a patent in today's market will ensure the security of a concept and will aid in future development of the product. The need for approval is necessary for our product to get it off the ground and help combat dehydration prevalence in children today.
Keeping your child happy and healthy has always been your biggest priority, and we'd like to share and aid in that valued responsibility. Our innovative solution to combat infant dehydration, the dehydration detection diaper. With our new acidity measuring paper found inside our diapers, you'll always know when your baby needs more water, or when they're at an ideal hydration level. Knowing your baby's needs and health can give you the peace of mind you deserve, leaving you more time to spend with your loved ones.